The solution to homelessness is affordable housing. If we did not have zoning laws that made it illegal to build affordable housing, we would have more affordable housing and less homelessness. If we had more federal funding for creating and preserving affordable housing, we would have more affordable housing and less homelessness. In the end, homelessness is a public policy choice. I have a few thoughts to offer on street homelessness in particular. For me, there's something profoundly dehumanizing about the American discourse surrounding street homelessness. We often speak as if those living on the street are quality of life conditions to be cleaned up or sanitary conditions to be swept away. We often speak of the street homeless as nuisances to be cycled in and out of the criminal justice system. And most people pass by the street homeless every day without even the barest acknowledgement of their basic humanity. For me, the street homeless should be seen not as threats to our quality of life, but as people in need of housing and services. The homeless should be seen not as an aesthetic blight on our society, but our society should be seen as a moral blight on the homeless who have been left to languish on the streets, unhoused and uncared for. Even though most homelessness is essentially a consequence of the affordability crisis, I do believe there is a mental health dimension to chronic street homelessness. And for me, the intersection of housing and healthcare underscores the urgent need to invest in supportive housing, which is housing with services. So my first question is to Ms. Rahman. Is it fair to say that supportive housing is not only the most humane, but also the most cost-effective approach to addressing the most chronic forms of street homelessness?
Definitely housing with services, permanent supportive housing has proven effective over the years in reducing chronic homelessness quite substantially, and would do the same for unsheltered chronic homelessness. Yes.
And it's more cost effective than psychiatric hospitalization, correct?
There's a lot of data that indicates that for people with behavioral health disorders, that housing and services is less expensive than leaving them on the street or in shelter and overusing emergency assistance.
Right, so it's more cost effective than psychiatric hospitalization, than the shelter system, than the criminal justice system. And yet there are more people in America who get mental health care from jails rather than from supportive housing developments. Indeed, one of the largest providers of mental health in the United States is Rikers Island, the New York City jail system. In FY 2020, it cost New York City nearly $500,000 to incarcerate an individual on Rikers Island. In FY 2017, it cost New York City $73,000 to provide emergency shelter to a family and $38,000 to provide emergency shelter to an adult. And so even if you have no compassion for the poor, even if you have no core belief in housing as a human right, the fact remains that permanent housing for those in need is far less expensive than incarceration or temporary shelter. Ms. Roman, do you share that assessment?
I do share that assessment. Yes, that's what the data indicates.
And the Ending Homelessness Act, which codifies housing vouchers for all, would radically reduce homelessness in America. I know of no other policy that would create so much affordability for so many so quickly. If the United States were to implement housing vouchers for all, hundreds of thousands of units, maybe even millions of units, would become affordable to families almost overnight. Does anyone have any thoughts on the importance of housing vouchers for all?
Well, certainly that's the case. There's a supply issue. Having housing vouchers would generate some supply, but there would need to be subsidy for other supply. But it would definitely, that's the solution. I will also just say briefly that when I started working on housing issues, which was in the late 70s, we had poverty, we had mental illness untreated, we had substance abuse disorders. We did not have homelessness. And that's because there was an adequate supply of affordable housing at the time.
And if I may, I would just add to everything that Nan just said, which I agree with, that if we were to go to the universal housing voucher model, we would be lifting 9.3 million people above the poverty line, and people of color would benefit from that quite a bit. So I think it's incredibly important to be thinking about this in the way you just laid it out, Representative Torres.
We have the power to create affordable housing on a mass scale instantaneously. What we're lacking is the political will. So I'll leave it at that.
Is that, I mean, did you get a full opportunity to raise your question, Mr. Torres? I didn't know if you cut off.
I did. If I don't know if I can make one more point, I don't want to.
Please, I'm going to allow Republicans, Democrats, Cincinnati Bengals, anybody to, have the, make sure you get your final thought out.
So there's a local example in New York City that illustrates the power of housing vouchers. New York City recently passed a law that raised the value of city vouchers to the same standard as Section 8. And before the law passed, there were only 564 units affordable to those with a city voucher. After the law passed, there were 72,000 units affordable to those with the city voucher tied to Section 8. So that is one example of the sheer power of a housing voucher program to create mass affordability and to do so instantaneously.